Okay, a quick review of the hamstrings. So, there's three muscles. The biceps femoris on the lateral side coming down into the fibular head. The semi-twins on the medial side, the semitendinosus and the semimembranosus are on the medial side. These muscles cross both the knee and the hip. So we're going to flex the knee and extend the hip by our hamstrings. So the biceps femoris, biceps, two heads attaching to the femur, biceps femoris. So the biceps femoris is going to start up, right up on your ischial tube on the lateral side. Not really, you don't really sit on it. It's up a little higher and off to the side, okay? And so the long head's going to go up to the ischial tube. The short head just starts on the femur, okay? And they're both going to go down and combine to one tendon and go to the head of the fibula, which if you've got your knee bent, you can easily palpate that very prominent cojoint tendon going down to your fibular head. So the biceps femoris are going to flex the knee, okay? Because they insert on the lateral side, they are going to laterally rotate your knee when it is flexed, okay? When your leg is extended, when your knee is extended, they're not in the right position to laterally rotate the knee, okay? The long head is capable of extending the hip, and the long head, because it works on the hip, can also laterally rotate the hip, okay? When working bilaterally, they can tilt your pelvis posteriorly, and that motion is going to flatten your lumbar spine, okay? So they go to the head of the fibula, and they're big knee flexors. Biceps femoris can have a couple of trigger points. Tends to be locally tender or go down to the back of the knee with the referral. The semitendinosus is, as the name suggests, down by the knee, tendon-like and skinny, and it is superficial to the membranosus. Most anatomy instructors love saying that the membranosus wraps around the tendinosus like a hot dog bun around a hot dog. I guess all anatomy instructors are hungry looking at all that meat all day, okay? So the semitendinosus is going to flex the knee, and because they attach on the medial side, they are going to immediately rotate the knee if it's flexed. All of your hamstrings are going to extend the hip, okay? And because this goes up to the ischial tube, and this is right on the bottom where you're going to sit on it, this is capable of medially rotating the hip also. All of your hamstrings, if acting bilaterally, will tilt your pelvis posteriorly, and that is flattening your lumbar lordosis, okay? Very important point, the semitendinosus tendon wraps around the tibia a little bit and is going to insert at the pes anserion, which means goose foot, by the way. And there it is. So some old anatomist looked at that after too many glasses of wine and said, wow, that looks just like a goose's foot. Okay. So you've got three tendons that insert there, and from top to bottom, they are the sartorius, the gracilis, and the semitendinosus. So those are the SGS tendons, and if it helps you remember them, the S's are alphabetical. So sartorius is before semi, okay? So on the top we have the sartorius, on the bottom we have the semi, all right? The semimembranosus, as the name suggests, is a little flatter and membrane-like as compared to the tendinosus. It lies underneath the semi and wraps around it a little bit. It's going to flex the knee. It will medially rotate the knee because it wraps around to the medial side. Okay. It's going to extend the hip because it attaches to the ischial tube, and it can medially rotate the hip. Okay. So it's going to insert on the back of the medial condyle of the tibia. This one does not wrap around to the front. So there's our trigger point in the semis. The interesting part of these is that the referral zone is up at the insertion, and people think that they have ischial tendinitis or ischial bursitis, when in fact it is a referral from the semis. Hey, that's all, folks. See you at our next quick review.